Yes, if you're having PRRT and you're probably going to need a little bit more protein in your diet because of tissue repair. So if your diet's not very high in protein, yes, you may have to make some alterations. You may have some intolerances, some nausea. I don't know. Some of these things can occur. Mostly it's just poor appetite. Yeah. So things that you eat. For people that not had problems with their appetite, and you just assume you're always going to be hungry. But for patients that experience this, know that it's like putting cotton in your mouth. It's hard to chew it. It's hard to swallow it. So you really have to find things that you can tolerate and consume in small amounts throughout the day, even on your bad days. And that some of these things are like the vanilla wafers and the graham crackers, some real easy foods to get down. So, but we try to get the protein up high. Sometimes we use specialty products for hydration. There's a product called Dietary, I don't know, I guess y'all know it, that helps with hydration, very important, and it helps with the GI tract healing as well. And some of those things we're seeing in people. I was in a wonderful setup practice, and they're still functioning. And they replaced me with another dietitian that is excellent, and I'm very proud of her. She's still there in that practice. But we were, I saw patients when they first came to clinic on their initial visits, and they were sent to me. Many times they were already having symptoms, of course, but that way I was allowed to go ahead and start working with. The nutrition is. There's not one person I can talk to with problems or no problems that I couldn't help them understand a little bit better, about how to make a plan. And I think as nutritionists, that's our main point is we're trying to get patients that can make a plan of how they're going to approach their nutrition, right? Because then we don't worry. It's kind of like today's things. If we have a good plan, that's just one part of the stress factor of this disease we don't have to deal with. So yeah, I'd love to see a dietitian come on. With that being said, there's very few of us that are paid to be in clinics. So it's hard to find dietitians that necessarily, unless you're in a big facility, you may not know that. I hate to have someone wait till they have symptoms, but if they're having malabsorption and weight loss, they need to immediately, be sent to somebody that knows what they're doing, or seek somebody that knows what they're doing. I can't tell you how, I'm a dietitian, but I think they're important, but I've just seen so much difference between practices that have an active dietitian, not myself and, myself included, but, otherwise.
Anybody, yeah.
That it just makes, it's a very important part of this team. And especially when you're dealing with malabsorption and the diseases that, such as this one, diet, what am I going to eat tomorrow? Questions, you need a dietitian to help you answer those. Yeah, we actually have an association, and the Academy of Nutrition and Dietetics, and you can find dietitians through that as well. We have in our association, we have oncology specialists, just like other people specialize in different things. We have specialists. And so we have groups that will help. I don't mind. I'm available, again, and if I can't see people, I'll try to find people. I have, there's not a lot of us, but there's some of us, and we're connected enough to try to reach out to some of each other if we can't get the help. But look for the Academy of Dietetics and Nutrition. That's the name. They changed our name. I got to make sure it's the right one. And did you want me to look? I can. I'm gonna give you my contact number, and if you have trouble, and I did this in a meeting the other day, I said they're gonna really make me go back in business. But I don't want you not to have access. So I'm gonna give you a number. I do have a number that I check it. I try to check it every day or two. And if you have questions, or if you do need to see me or something, or have some of your healthcare professionals that have questions, that's really where a lot of this comes in. You'll be able to at least get me. So I put a new number so that all that goes to this phone is really neuroendocrine stuff. So
got it.
You want me to give that number out?
Sure.
Okay, it's area code 225-500-6092. Again, that's 225-500-6092. And I'll be glad to, I enjoy taking care of patients.
Sure.
Well, you really may not be able to bring your platelets back up
with
diet. But there's some things that are important while your platelets are down that you need to know. So let me just go with that. We want you to eat, for your platelets, just still try to get back on your proteins where you're eating the lean meat again. I think I would definitely put you on a multivitamin if I was seeing you. But what I want you to make sure that we want to watch for foodborne illnesses, because the biggest problem with a low white count is to get an infection in your GI tract just because the food you ate wasn't, carried some bacteria or something through the GI tract. So it's very important that you peel your fruits and vegetables. You want to, I really like them cooked. If you have deli meats, you need to always, and this is for everybody. This isn't just for a low platelet. This is for all oncology. This is for everybody, general population, but definitely in oncology. You need to steam all meats. If you get the deli, back up to 100 and about 150 degrees, and then let it cool back down before you eat it. Everything needs to be reheated and cooked. Even all canned goods need to be brought to a safe temperature and then before consumed. Especially with leftovers and foods such as that. But no raw food. Do not eat raw foods. Don't eat off of any buffets. Make sure, of course, now you can do that anyway if you wanted to, I don't guess. But be real careful. I think foodborne illnesses is our biggest concern with a low platelet count. But put something in your mouth every 2 to 3 hours. So the problem is just losing that appetite and not eating. So whether you're hungry or not, peanut butter crackers, peaches and pears, we talk about fruits, those tend to do real well and easy to get down. Mm-hmm. Low-fat cottage cheese. There's different things that you can get little small amounts of throughout the day. Yes, it can. And if people are borderline, it won't make you diabetic, that's what we say. But if you're it can increase hyperglycemia, which means increase your blood sugar above a normal level on a fairly regular basis. So if someone has been in this hyperglycemia but not diabetic yet, and they start having the shots, it may put you over. You may actually become a little bit more hyperglycemic and may actually have to be monitored and medications in some senses.